Welcome to the Registry Insider. I'm Bill Seifarth, CEO and Executive Director for the National Registry of EMTs. And on today's episode, we're talking about the age-old protecting the public through a systems approach. Joining me today is a return guest, Dr. Paul Rosenberger, who's on the staff at the National Registry of EMTs. And Paul, thank you again for joining me for yet another episode.
Yes, sir. Glad to be here.
So this, used to be when I started the registry, or for the last decades, what does the registry do? Well, they protect the public. And we do that obviously through our examinations, and we do that through our certification, recertification process. That makes sense. But it's not us alone that does it. So there's a lot of other elements in this system. The American Heart Association has the chain of survival, and you've kind of coined through the scope of practice, as well as the EMS Education Agenda for the Future, a systems approach, this concept of a chain as it relates to the elements involved in protecting the public. So tell us a little bit more about the concept, where it comes from, and then let's talk about each of those elements in this system or this chain link of protecting the public.
Yeah. So when you remember or you reflect on that chain, it has a bunch of steps in there. And the goal of that chain is to have good resuscitations for people who are in sudden cardiac arrest. And so there's this link and this link and this link and this link that goes across that chain there. And they're all intertwined.
And dependent on each other.
That's right. And all of them have to be intact and operating to have a very good outcome when it comes to resuscitation. So, I think everybody in EMS is very familiar with that. And so I also went to the scope of practice document. And if you look at the front of that document, they have 4 areas. It's educated to perform, certified as competent, licensed to practice, and then finally that 4th one is credentialed by a medical director to actually go out and take care of people with the local flavor of whatever that is. And so I saw those 2 things and I thought, wow, these things would work together really nicely because they are all chains or links in a chain. This chain's not quite as big, but it definitely has four links there. And those 4 links, have to work together to be strong. And so if any one of those links is broken, then we're not going to have...
The system is weak.
That's right. We're going to have people who are getting bad care or incompetent type care. And so again, I think the really important thing is that we all work together, the educators, the National Registry as the certification body, the state offices who do criminal background checks and make sure that people are legit and safe to go out and do provide that care. And then ultimately, the medical directors involved, the organizational leadership is also very involved in that to make sure that the person they hire has met all those links and can go out and provide safe care.
So you mentioned the scope of practice document, which is kind of where this originates from, but that's found on ems.gov.
Yep.
And they can just search for scope of practice, the most recent copy or version of that, I should say.
Yeah, I mean, even just on the cover, just look at the cover, and there they are, these 4 areas that protects the public and leads to competency.
So let's go through those components again. So you said the educators, I think was your first group.
So the first one, as you know, a person decides that they want to be an EMT or a paramedic, and so they go find a program locally, and they enroll into that program, and then they are educated by that education program and the faculty. And at the end of that program says, yeah, we think this person's competent. Let's move them to the next step, to the next link. And so that next link is us. And so we are that third party that verifies that competency. We're objective, we're accredited, and so we make sure that they meet that national standard.
Going back to the educator, it's vitally important that the educators not defer to the National Registry exam. When they know a candidate or a student is not performing well and they have in their gut, this kid is not going to pass the National Registry exam, why forward them on to take the exam?
Yeah.
That's the responsibility of the educator
to
say, you know what, this kid's not yet competent. They should not go to test National Register, whether it be for cognitive reasons, skills, or affective domain. So if they're not competent, they should not move on. So the student should have successfully completed that EMT program or paramedic program before they sit for the National Registry exam, and it's incumbent upon the educator and education program to weed out the competent from not yet competent. and then send them to the National Registry for independent validation.
In that situation there, that link would be broken.
Correct.
And so we don't have the 4 links working together.
Mm-hmm.
So the educator has to say, yes, this person is competent or not. They have to make that decision, because I know locally where I come from, there are programs that say, well, let's let the National Registry weed them out.
Mm-hmm.
And that's not our role. It is our role, but
Right.
it's also the educator's role to say, you shouldn't even reach the second link.
Correct. So going back to what you're talking about, this second link, that's our wheelhouse, the National Registry. You said we're independently accredited
Yep.
through NCCA, the National Commission on Certifying Agencies. So we have to meet certain criteria to be able to offer our examinations to be a certification organization.
That's right.
And we do with our examinations. We make sure that we maintain compliance with NCCA, and we are continuing to improve our examination to effectively determine competent candidates from not yet competent candidates.
That's right.
And it's a very lengthy process. We did formerly another podcast on the exam development life cycle.
Yeah.
So people can go to there to find out more about what goes on in terms of how we make the sausage or how we make the examinations. But we play an integral role and often viewed as a safety net to catch those who are not yet competent that have graduated from education programs.
Yeah. And you've seen me talk many times about how proud I am that we have that merit badge
Mm-hmm.
of the NCCA accreditation, because we have a credible test
Mm-hmm.
and we're graded to
Mm-hmm.
make sure that we do this properly and consistency. So, when we have that NCCA accreditation, it tells the world that we are doing things just like the physician testers, the nursing testers, any other type of allied health type organization that has the NCCA accreditation. So when we get together at Thanksgiving, we can sit at the big table and not at the little kids table.
That's right. EMS is certainly a legitimate profession because of what we do
That's right.
and the systems approach. So after us, what's next in this?
So
Shame.
then, the educator has said, yep, they're good. And we've tested them and we give them thumbs up as well. That third link is where they go to the state and they create an application. And on most places, probably all places, they get fingerprinted and they do a criminal background and they make sure that they've met all the requirements of that particular state. So then the state grants them a license,
Mm-hmm.
and that license gives them the authority to go out and practice.
And that's important to differentiate certification from a licensure. Some people think that once they're nationally certified, they have a green ticket to function in any state, and that's not the case.
Yeah,
They have to be
Yeah.
licensed by the state.
Yeah, we just certify.
Correct.
We certify competency.
Right.
The license, that authority to practice, is granted by a state.
So, and the state has constitutionally a responsibility to oversee their
Public protection.
public protection. So they're doing their role in concert with us.
That's right.
It's a partnership between the educators, us,
Yep.
and the regulators, the state EMS officials.
That's right.
What's the fourth?
So finally, when they get that license, now they're employable.
Mm-hmm.
And so then they can go to a fire department, to a county or city EMS, to a private EMS service, in some cases hospitals. And they then are credentialed to that local protocol or to that local operational guideline, whatever it is that they're working with. And when they get that, they probably should be precepted.
Mm-hmm.
Shouldn't say probably, they should be precepted and credentialed and taught the ways of the locality.
Mm-hmm.
And when they meet those requirements, they then could go out and practice and answer calls and take care of patients. Yeah.
So it's a pretty lengthy process to go through, but there are 4 key elements to ensuring that the public is protected. And something I didn't mention early on, but I'll mention now, the role of public protection is really important. And I'll give you an example why. If you need to go to a physician, let's say a pediatrician, a dermatologist, a cardiologist, or you need to go to a lawyer, or you need to go get your car repaired by a mechanic, you can go online and Google and see the reviews of those physicians, of those attorneys, of those mechanics. They're widely available online, and you can say, I don't want to go to that dermatologist because she's got a lot of complaints or he's got a lot of complaints against them and no bedside manner, what have you. When the public calls 911, they don't get to choose the paramedic that shows up. And therefore, this systems approach, these 4 links in this chain of public protection, is really critical. And the public depends on that.
Yeah.
The public deserves that.
Yeah, I mean, to add to that, when somebody calls 911, they generally don't know how the system works.
Yeah.
They know they call 911 and somebody's going to show up in 5 or 10 minutes, but they don't really think about all those previous steps that have been done to say this person's going to be competent and be able to take care of my mother, my father, my family member, or myself. And so with those links, they're going to get a skilled and qualified, competent provider to take care of them.
As long as the
Links work.
Yeah.
Yes.
And are working together in that systems approach.
That's right.
Awesome. Well, Paul, thank you again for joining me for yet another episode of the Registry Insider and for what you do at the National Registry and our national EMS community.
Sure. Thank you.
Thank you for joining us as well. And as always, stay safe.
Thank you for joining us for this episode. If you wouldn't mind, please click the like and subscribe buttons, as well as the notifications so you can get notifications of upcoming episodes. Also, for the latest and greatest happenings of the National Registry, feel free to go to nremt.org. Thank you very much. And again, stay safe.